Today I'm going to show you how to visualize a vertical root fracture in Romexis 6.1. This patient, she came in about a month ago complaining of cold sensitivity on the lower left. We cold tested on the lower left quadrant here in the office. We ended up referring her to the endodontist. The endodontist diagnosed a vertical root fracture, and he would like to retreat tooth number 21, which has a history of root canal therapy. But seeing his diagnosis, I went back and looked at the scans, and it's more clear to me now that there is a vertical root fracture, and I'd like to show you how I visualize that. So I am in Explorer view. I'm going to slide over, and this is how I always line up the tooth for visualization. I'll holding the right mouse button, I'll rotate the file. Looks like we got a little smiley face right here. That's kind of cool. All right, and I'm going to zoom in here. Okay, so here, right here, we can see it. So I'm going to grab the coronal slide view here and slide back and forth, so you can see disc or buckle to the fracture. You can see bone, and then there's the fracture, and then here's lingual to it. So there's bone on both sides of the fracture with missing bone in the middle. Another view that we can take is I'm going to grab the coronal view and raise the scan up, and then if you look here on the axial view, I'm going to rotate. I'm going to hold the right mouse button on the sagittal view, rotate it so I have the defect lined up right on the coronal plane, and then I'm going to go, let's see, from occlusal, I can see right here, I'm looking at the axial view, and you can see right until there is where the defect runs out. So let's see, I'm going to slide this back over, zoom this in, I'm going to raise this up. So the vertical root fracture of the bone used to hit the tooth about here. Now it is here. So we've got 1, 2, about 3 millimeters of bone loss at where the vertical root fracture is. So if you're watching this and you're not a dentist, I'll explain how the bone loss happens at the fracture. So what happens is the tooth, like this tooth has a history of some restorative work, fillings, it's been an occlusion. The patient's at least in her 50s, I think maybe early 60s. So she's been functioning on this tooth since she was 6 years old. So sometimes right here on the tooth, on the chewing surface, you start to develop a crack, and sometimes that crack will propagate down the tooth. If the crack is above the bone level and not into the nerve tissue, the tooth could have a crown or a filling to be repaired. If that crack runs into the nerve, the tooth would need a root canal and a crown. But if the tooth runs below the bone, the only way to really remedy that is to extract the tooth. In this case, we're going to place a bone graft and a dental implant and replace the tooth. But on a physiologic level, what happens is that right below the bone, the tooth is surrounded by a ligament. So all the way around here, it's surrounded by a ligament. So where the tooth fractures, there's a crack, and the ligament can no longer be attached there. And when the ligament is lost, the bone is lost. So that's where we can visualize bone loss along the fracture. And then from there, bacteria can begin to leak into the crack. It also, in this case, made the tooth start to become sensitive to cold. And sometimes we can visualize the cracks will be on the outside of the tooth. Occasionally we'll have the fracture line be inside the tooth. So when we go to start root canal treatment, we might visualize that crack under the microscope inside the tooth. In either case, the tooth would be non-restorable and need to be removed. So I hope that helps as far as how to see, how to visualize a vertical root fracture. In some cases like this, where the fracture is right at the contact, it can be difficult to find that with a periodontal probe. But I will, I'm going to actually be removing this tooth in a couple of hours from now, so I am going to take another look just to help myself. I always like to just calibrate myself to to be able to identify these problems for patients in the future. So I hope that's helpful and I hope you have a great day. Take care.